Okay, so welcome, Coach Paul Gorries, which is the current South African sprint and relay coach. And then we also have Dr. Byron Haupt, a close friend of mine, and also ex-athlete himself. And then which specializes in sports, aviation, and medical medicine. And then also we have Dr. Ntokozo Mabena that's joining us today as well. That's also very actively involved in the sporting arena when it comes to sports medicine. Welcome, gentlemen. How are you guys doing?
Well, thank you for having us.
We're good. Thanks for having us.
Here we go. Okay, so I'm first going to start off, guys. I think there's lots of uncertainty. There's lots of questions from coaches, athletes, any sports person out there, how they go about going to training, when they're going to go back to training. But I think what is important is there's a couple of factors that we need to consider before we go back to training as well. So if I can first ask this to the medical doctors, you guys can decide who's going to go on this one. Question that we have is, what medical factors should one consider when returning to play physiologically? So what do we need to look out for those things before we go back to, I would say, the norm? Dr. Haupt or Dr. Mabena?
Well, I mean, look, there's a lot of ways to answer that question, but the first thing would be,
Yeah, no, I can hear you guys.
So essentially,
yes.
I mean, the first thing that we need to look at is, you first need to ask the question, was this athlete infected? Was this a patient or an athlete that had an infection with coronavirus, yes or no? Because obviously, if they had an infection, then we need to look at them in a completely different light and need a completely different screening. Obviously, as we know, infection, that basically involves the lungs and it involves the heart. More recently, they've been looking at all the effects that it has on the heart, which they didn't realize beforehand. But I mean, so that's one half of it. The other half of looking that we need to look at is the fact that you've been detrained, essentially. You've been training, you're at a certain level of fitness, and the body hasn't been training at that level for a certain amount of weeks. What we need to look at is, what is the cardiovascular system doing? What is the energy system doing at that stage as well? I mean, during detraining, you're going to have various systems that don't shut down, but they just down-regulate and slow down. Any athlete coming out of this lockout period, they need to, basically, from the coach's side, they need to evaluate where that athlete is. You know your athlete, you know your sports person, you know yourself as well. Where were you before this, and where do you need to be at this point? If you look at detraining, after detraining, for every 2 weeks that you've been detraining or not training at all, you need to be putting in 8 weeks. You're coming out now, you know you need to be training for at least 4 to 6 weeks to get back to that level where you were at. And I mean, at that stage, we also need to look at various factors. Are you doing a sport that is strength-based? Because strength-based things actually, and sports, they actually have this reciprocal effect where you'll notice that you might actually come back at a percentage point stronger than you were before that break. It's been pointed out in various studies. But if you're looking at a conditioning-based, you're looking at a fitness-based program or training or sporting activity, look, you're going to be losing quite a bit every week of not training. If I'm just going to throw numbers, I hate throwing numbers at people, but every week that you are doing normal activity, not training as an athlete, you're going to lose 2 to 3% of your fitness, essentially. But if you're at least able to do 25% of your normal load during that period, you only drop by 1 to 1.5% per week. So that's why we want guys to be training during this period, doing something. We're not saying you need to be at your normal load. You don't even have to be at half your load, but only 25% of your normal load will actually decrease your losses by 50%. So that means cardiovascularly, you're going to be doing better. you're going to be able to hold on to those losses a little bit less. And that's important for the guys. And going back to that first point that I mentioned, for any athlete that has been infected, we need them to get a full cardiovascular assessment by a doctor. Because unfortunately, this virus does affect the heart. Even those that have been asymptomatic, that have shown no symptoms but have been infected, it has been shown that there is mild infiltrates to the heart itself and the muscle tissue of the heart. So any athlete coming back does need to see a doctor, does need to get stuff like an ECG workup, just to make sure that there's nothing that we need to worry about specifically sent for further workup. Paul, is there anything from a training perspective that you'd like to add to those things?
Look, for me at this point in time is, what I've personally done with my group, when Olympics was cancelled, we decided as a group, or postponed, we decided as a group that, that's it. We are not going to risk anything. Basically the season is done for us. So what my guys have been doing, from now, as of lockdown to now is, they've been doing some circuits. They've been doing some exercises and things that, at home, at least just to keep going. So once we start our off-season training, they don't start from scratch. Also the first 4 to 6 weeks, once we start basically off-season training is you can't even be specific at all. You're gonna have to coach what you see. So and then work on progression from there. So we're gonna start very, very, very slow because hopefully we can start in June, July, and that will give us enough time to prep for next year's Olympics.
Which I think
here's a question from the medical side to the coaching side.
Yeah.
Are your athletes going to be assessed in any way?
Yeah. Look, before we'll start, luckily for us at Dixon, we have the facilities to do all of that. So everyone will go through a medical screening first before we start, before we even attempt to start training or to go back into full-time training. Like I said, the first 4 to 6 weeks, it's going to be really, really easy training. Anything from 3 to 4 sessions, and then we'll start, building it up from there. With efficient recovery, and obviously, like I said, we've got a nice team at Tux that we can bounce off one another nicely in terms of where the guys are testing, what we need to do, all of those sort of things.
Yeah. I mean, I see with those 2 to 3 sessions, what we're talking about is as well, you guys are basically reconditioning the energy systems, everything else like that.
Correct, yeah. Now, look, we won't even tap into the CNS system, so we'll just slow pick it up by the week. And everyone will probably be on a different training schedule. You can't go back and, some has done a little bit more. And I know how athletes are when they're at home and they're having a lot of them looking at others as a break.
Come back with muscles.
Exactly. So the condition of all of them is not going to be the same. So that's why I say you're going to have to coach what you see.
Yeah. And I think that is so important that Paul mentioned is that you have to coach what you have to see. And I think that is where coaches must be, I think, very careful in just because I think what Byron mentioned also was that athletes is, if you're not going to be putting on that loads or activity during this time of the COVID-19 where everybody's locked down and at home, we're going to run the risk to perhaps put the athletes under load too quick, too fast, which means that you can also run the potential risk of running the athlete into an injury. And I think that is from any sporting point of view. Then just my next question would be, because I think Paul already touched on this one, but the second question would be
just one thing, Alroy, before you go. Mm-hmm. Just from a coaching point of view also, your athletes are different creatures. I call it because, I've been there myself. In terms of an athlete, it's very difficult to coach someone without a goal. and with this year basically being done and dusted, it makes it easier. Once you make that call and say season's done, we're starting all over. I think most of them, or the senior athletes, have an idea what you're talking about anyways.
Yeah.
Where we're going to start. So literally we're going to start from scratch.
Yeah, and that is so vital, and I think it's important. Just Byron, before you come quickly there, is that like with the goal setting, because then now if you know what your goals are, and touching on the base that Dr. Haupt also asked earlier on about the testing, then you know what to test for, when to test for, and how your whole schedule will look forward. So, and I think that is important that we need to consider from a coaching point of view as well. Byron, you had something?
No. Basically, I just wanted to basically say that thing. That means essentially, you need to know where your athletes are at. You need to know where you're going, and those are 2 points. And you figure out where you're going in between. That's where medical, coaching, S&C, they all come together to make sure that firstly, you don't immediately injure these guys coming back in training and pushing too hard, and secondly, you don't cause them to have that drop in immunity that happens once you push those training levels up too high. I mean, hopefully many people have heard or learned about the J curve, about immunity and training, where you've got this nice little Goldilocks area where it's the perfect amount of load for your immunity. But once you push past that, you're going to get guys actually increasing the infection rates. Hopefully that's why the big community of the athletes we're talking about in the sport, they actually have a much lower J curve, and they can actually handle a lot higher loads before the immunity actually gets put down as well. But that's always something that coming back off any winter session, coming back off this, artificial winter, the training area that coaches need to always be aware of. Pushing too hard, pushing too quickly, causing them to get ill. And that's what you don't want during this outbreak, during this pandemic. They might not have had infection, you start training and they come back and they actually do have an infection. So that's something that needs to be taken slowly and just taken step by step as well.
Okay, welcome.
Exactly. I mean that's why I said, it's going to be progression phase, with most of the guys. It will be, for me personally, it will be 3 to 4 sessions, not even 4, especially the first couple of weeks. It will be 3 to 4. And that's where your periodization plan is so important in terms of where you are in your phases. What do you do when you do general phase of training, specific phase of training, pre-competition to competition? We have a lot of coaches out there that doesn't even have a clue what those 4 phases are. So, they just jump from the one thing to the next thing, one thing to the next thing. And that's mostly how athletes get injured. So, and that's why I say, for me, the first 4 to 6 weeks, I'm going to have to coach on what I see. I'm going to have to monitor the guys, in that period. And thereafter only, we can then slowly start moving into, the general phase of training.
Guys, we have Dr. Mabena back now, and I think he's probably best suited for the next question that we have.
Sorry about that. I'm good.
So, and I think this one affects athletes a lot more than any other personnel around this whole topic, the psychological side of COVID-19 on sports people. Dr. Mabena, can you just give us a little bit more insight, possible psychological effects that the sports person might be going through during this time as well?
I'm sorry, physiological side. I don't know if we're only addressing athletes or non-athletes, but I just wanted to also mention some of the comorbidities that some people might have in terms of a medical history, especially because we know that COVID in general. So we did cover that, yeah? Or
no, we're getting there.
We continue. So essentially, one of the things that I do want to cover is that, for example, our athletes, or our non-competitive athletes with lung issues or lung conditions that are, well managed, diagnosed. I think it's very, very important, especially for that actually undertaking an activity like Byron mentioned, to actually have a thorough examination done where they are assessed and monitored throughout the different phases. Where coaches also touched on in terms of getting back to full fitness. So anyone with the respiratory or any condition that can affect your immunity, essentially, and drop your immunity. I think that's just one thing I just wanted to add on there.
Yeah.
Regarding psychology, I think sports psychology is sort of not everyone actually see the impact that a player's psyche, essentially pre-match, during the lockdown, in terms of pre-season training during while at home with these home videos, that a lot of players actually affected, psychologically, in the sense that a lot of them are going to what we call a major depressive episode, where they start experiencing symptoms like, for example, loss of appetite, insomnia, so difficulty sleeping, maybe because they're worried about, competitions that are being cancelled, worried about income. Those kind of issues are very, very real for the athlete. We're talking about, for example, mood swings that actually typically happen within the functional shift phase, whereby an athlete can actually feel absolutely horrible in the morning, but as the day actually progresses, they actually improve in terms of their mood and their functioning. So a lot of those things, I think, individually, a coach will have to actually assess. There's a questionnaire or a screening questionnaire that we use for the athletes themselves. Can you hear
me? Yes.
Yeah, we're with you.
The health questionnaire, for example, for all athletes, in terms of pre-season assessment, pre-season screening, should be done for all the guys, especially returning now after the COVID period. And obviously, you'd have to want to highlight, your high-risk group, and actually, emphasize the importance of the one-on-one connections, especially with the coaching staff and the player. If you do identify a player who, for example, is experiencing these depressive symptoms, or is really, really struggling, or isn't performing the way that they usually do, I think it's something that should be really taken seriously, and that athlete actually assessed and supported the best way possible, for example. So I just wanted to touch more on that, more the depressive symptoms that are associated with them, and obviously because of the depression, the anxiety also comes along with it for the athlete, and it'll definitely, it's proven with research that it does affect athletes' performance in terms of their psyche before games, how confident they are in their abilities, and also the support offered by the club to the various athletes. Yeah. So I think those are the factors that I just wanted to touch on. All right.
And I think just to touch on what Dr. Mabena said, that I think we've been seeing this in the media also. I think world bodies has also been touching on that of athletes going through that depression phases as well, because all of a sudden, what you are used to in your routine, and where you take out your, I would say, some stress and frustration, is now all of a sudden been taken away from you. And it's important that we need to find different ways to look at these and how to assist sports people, because I think it's very difficult for some people to actually deal with, because sometimes a person don't even know he's going through depression. And like Dr. Mabena just made mention, there was, you find it in small things like eating disorders and stuff like that, and doesn't have an appetite also. So yeah, anyone want to touch on that?
Well, I actually wanted to ask Dr. Mabena what he believes would be good strategies to, basically support the athlete during that period. What does he think would be the best?
So personally for me, man, Dr. Haupt, personally for the athletes that I usually work with, so what I try to do is at pre-season, I'll do the health questionnaire, and basically see where the player is in terms of mood, how, self-esteem, confidence, those kind of things. I look at pre-season, follow the player throughout, and obviously, but let's say, for lack of a better example, if you see that your player's performance, for example, during games, let's say rugby, is deteriorating, those are the incidents that I'll actually make note of, and then essentially with with individual sports, the same thing. And then you want to actually, one, go through those things step by step, not rushing the process, but also trying to understand essentially what's happening with the athlete and actually just listening more than anything else. The second approach is that essentially mid-season, I'll also do another assessment just to make sure that health-wise, in terms of mentally, the athlete is strong, still feeling good, still feeling confident to their abilities. And then obviously post-season will just be a reflection, just to look at essentially the journey from the beginning of the pre-season training through the season, and then also post-season, just to make sure that we prepare for the next season. Yeah. But the one thing I do want to mention, Alroy, and to you, Dr. Haupt, also, is that the psychological aspect is very real. You can imagine, for example, a soccer player, who's a defensive midfielder, new, just got signed, boom, lockdown. All of a sudden, is not able to, prove that they actually can earn a position in the starting lineup. So those are real factors, and I think it's the safe way, or to safeguard it, is to do it as not on a regular basis, but at specific intervals, in pre-season, during the season, and then post-season. Yeah.
Okay. Paul, I want to pose this question to you as a coach on national level and working with Athletics South Africa as well. We've been talking about psychology now, and I think we are aware, and especially within track and field side, that all athletes don't have access to professional medical teams or professional psychological teams around him. What would your advice be? How can a coach approach this situation in a sense of when they need to help an athlete psychologically?
Look, that's where your role as a coach, becomes more important. The problem is a lot of people coach the athlete instead of coaching the person. I cannot coach if I use examples within my training group. I cannot coach Simon the same way I'm coaching Enrico. They are from two totally different backgrounds, two totally different ways of thinking, and I have a different relationship with each and every one of them. So with me as a coach, you have to be sharp when it comes to things like that, because sometimes the guys are not training well, and most of those times, that in my experience, it's really they're not training related or conditioning related. Sometimes it's a mental issue. You have some athletes also that they train very well, but when they get to race day, they give you the complete opposite of what you had in training. So it's important to have a very good understanding with your athletes, a one-on-one relationship with your athletes. Every week even during the lockdown, I speak to each and every one of them on a quick call. How are you doing? Are you doing the circuits? Those sort of things. And sometimes when you speak to them, you don't speak athletics, for instance. Just ask him how things are in general. How's things at home? How's your parents? How's this? Do you need something? Is there something I can help with? Do you need food? Anything that there is, because we always assume that everything is okay, and then it's not okay. And some people, they have their own pride and stuff, and they're not going to speak to you about it and say, look, this is the issue that we're struggling with at home. And especially during lockdown, it's tough times for a lot of people out there. So for me, I make it a personal agenda for myself to find out, are the guys okay? Do you need anything? Is there anything else I can help you with? You don't want to speak to an athlete during this time and just ask about training. That's the last thing on a lot of guys' mind. You just want to make sure that they're mentally in the right space. So when initially you slowly start moving back to training, you're going to get more out of them anyway. So, so that's what I say. And that's where a lot of coaches go wrong. They coach the athlete instead of coaching the person. For me, as I believe in coaching the person, because every single athlete has got different needs. So my approach cannot be the same with each and every one of them. So, and that's how I do things in terms of, my specific group, even working with the South African relay teams and the needs of a Clarence Munya is completely different to the needs of a Kanye, even their mental space, how they prepare for races, those sort of things. They're on a completely different level. So, me as a coach, I need to find the middle ground so that everyone can gel. So, and And that's where I personally feel a lot of coaches go wrong. They sometimes just coach the athlete instead of coaching the person.
And I think just to touch on, I think it goes back to even the basic beginner level of coaching or any coaching qualification, that I think you as a coach, you need to fulfill all those roles as a teacher, a parent, a psychologist, and like Coach Paul just mentioned now, is that making sure that the person is fine first instead of worrying about the results or anything like that. Does the doctors have any questions on that, or any response they want to add onto that question?
No. Before we move on with that, sorry, Alroy, you also need to know when to back up. When all the things that you said now, it's also very important when to back off instead of pushing the whole time. You know what I'm saying? Sometimes people don't want to talk. If they don't want to talk, leave them. Exactly. Allow them not to talk. Give them their personal space till they're ready to talk. You just need to make sure that you are there for when they want to talk.
Exactly. And
I think sometimes a lot of people push because they push their own agenda and not the athlete's agenda.
And I think that is.
I just have a question for Coach.
Yeah.
Coach, so I just want to ask you: do you think this is now just my question personally?
Yeah.
That the culture in sports at the moment is still result orientated, and actually, like you're saying, that a lot of people focus on, for example, the results and not the player. Do you think that is going to change anytime soon?
Look, obviously we're in a competitive world, so, and especially when you're in a sporting environment, it's not something that I think is going to change. At the end of the day is, for me, what I think, you need to work with your person or your athlete the best way possible to get the best result out of him or her at that particular, from what they want. That is, those competitive nature and stuff is not going to change. For me personally, I have a simple thing with my guys. Before we even start off-season training or anything, it's like you dot down what you want to achieve this season. My goal is, as a coach, is I need to find the best possible way to get you there. Sometimes it works and sometimes it doesn't work. That's life. That's human being. You know what I'm saying? So it doesn't always work out. But for me as a coach, I need to find the best possible way to get you. You know what? You're unrealistic. That's not going to happen. Because at the end of the day which means I don't believe in you and I don't believe in your abilities. And once you start having doubt between a coach-athlete relationship, you can forget about it. You can be the best coach in the world. You can have the best training program in the world. Once there's any bit of doubt from an athlete side, you're not going to get that result.
Thanks, Coach.
Okay. So I just have 2 more questions still, and I think
Alright.
we have
anything else from your side?
So again, we have about 8 minutes left, and then we actually want to leave some time for questions from people that's streaming from Facebook as well. So those that are streaming in from Facebook, guys, please feel free to leave your questions in the comment, and if we have time still during our live stream, then we will respond to them as soon as possible. We have been getting some good responses in via the Facebook stream, and it's really interesting to see the engagement from you guys, and that's such a hunger for information around this topic of how do we go about getting back to play in sports. Now, doctors, this is my last question from a medical point of view, would be is, from a medical point of view, what safety needs to be looked at going forward? Maybe we're going to go back to, if we go back to facilities events, what safety measures does coaches or parents or teachers need to look at when it comes to physical activity again?
Byron?
Okay, so look, in terms of safety measures, I was just waiting for it, man. Essentially, it's always going to be exactly the same measures we have right now. It's about social distancing. You need to know that these athletes, these sports people, parents, everybody, you need to keep your distance. You need to make sure that you're sanitized. You need to make sure that if you've got anybody with any type of symptoms, you shouldn't even be outside the house. If you've got a younger athlete at home, you need to decide, are you taking this person to the track or to the field? Is there a cough? Is there a sneeze? Are they feeling unwell anyway? You shouldn't even be getting into your car at that stage. The most important thing is minimizing the risks and minimizing any type of exposure to yourself or to anyone else. As an athlete, what we're doing with the team sports, rugby specifically as well, we'd want you to wake up in the morning, go through a little questionnaire, listing symptoms. Do you have any of these? Yes or no? If you do, don't even get dressed. Message your team, message your coach, message your medical team. Let them know that, you won't be coming to training. You've got symptoms that are going to put you at risk or somebody else at risk. In terms of if you're going to be doing, it depends on your sport really. So you've got team sports, ball sports, you've got your individual sports like athletics. Athletics is easier. Individual sports are much easier because the interaction is a lot less. You're already social distancing. You're already separated from anyone else at that stage. When it comes to team sports, again, you're going to need to make sure that you keep a specific distance amongst each other. You can't have the whole team on the field at the same time. You're going to have a certain amount. At the moment, we're looking at things like 10 people per team. That those 10 people are always going to be together for the next 2-3 months. They'll be a training group on their own. We don't want different people exposing themselves to different groups at the same time. It's going to be difficult. Detergents and sanitizers being used by sporting teams, but in terms of keeping infection rates down, that's the route we're going, essentially. We're not trying to be very specific in terms of teams or what sports, but essentially these are protocols that are being set up for each sporting code, and we just need to look at them and follow them.
Dr. Mabena?
Just to add on to what Byron's saying, I just want to make 2 points. I think the first one to the players, I think something that is very, very important. Can you hear me, Alroy?
Yes, can you hear you?
Yeah.
Can you hear me?
Yes.
Yep.
Sorry about that. I think there's just 2 points I just want to add. Yes, 2 points I want to just add to what Dr. Haupt said. The first one is, let's start with the management. I think my advice would be for all clubs or even individual sports to have your own PPE pack, basically all your protective gear for each and every individual. So you have your own bottle of hand sanitizer, for example, your own, for example, hand gloves, if, for example, you need to wear gloves. But each player should actually have their own individual thing or individual pack that they can actually use and say, this is mine, and not sharing it with other people, just to minimize the risk. The second point I want to make is also to now directly to athletes that, transparency and honesty is very, very important because, you can imagine the pressure coming back into an interrupted season whereby, athletes are fighting for positions on the field, or they're trying to get, different times, and they don't want to miss that practice, So let's say you have a bit of a scratchy throat, you're like, maybe it's just this and that. You go to practice, you're putting other people at risk, other players at risk, other colleagues at risk, your family at risk. So I just wanted to make those 2 points on top of what Byron said.
Yeah, I think that is really.
Yeah.
Really
also, I think, a lot of us should realize, Yeah. Okay. Can I speak? One thing that, just to add, to what Dr. Mabena said is that one thing that we should also realize is, and, also in connection with, what Dr. Haupt said is, life as we know and sport as we know it, once a return is not going to be the same way, and I think, the sooner we start realizing that, the better. We are not going to, the minute they say, okay, cool, you guys can get back to training and stuff, and then everything is going to be exactly the same way it was before. There's a lot of different things. There's a lot of things that, each one of us as individuals is going to have to do completely differently. You're not going to go back into training the way training was. Your groups is going to be smaller. Just like Dr. Haupt said, social distancing, all of those. So your training program and your training schedule itself, it's gonna have to be completely different.
Yeah. So, last question quickly.
Fully agree, Coach. Fully agree.
I think you've touched on it. I think we have just so a minute left quickly. But Coach, what would your advice be and I think you touched this early on as well. Going forward, how do you resume activities? I would say if you can give this our personal advice, is that what did you tell coaches to do in this next, or even this time during lockdown? How do they go about? Because we don't know how long lockdown might be. It might be till August in Cape Town. It might be till June in Johannesburg. So yeah.
Look, I cannot tell other coaches what to do and how to work out their schedule.
Yeah.
But, communication is going to be key, like Dr. Mabena and Dr. Haupt mentioned, in terms of where we're going with this. You have to communicate with your athletes. Some athletes are not as fortunate. For instance, like, a lot of us at the University of Victoria, we can do a full medical screening. You are going to have to go, like I said before, you're going to have to coach what you see. You're going to have to communicate with the guys. You're going to have to constantly check with the guys. How are you feeling? Is everything okay? Those and those athletes they're gonna have to be brutally honest with you. Because at the end of the day, it's just not about them.
Can you just finish up on what you said earlier on that you can't tell any other coach what to do, but what did you do with your guys in this time until COVID-19 is done?
Look, like I said before, I cannot tell other coaches what to do because I don't know what's the situation. I don't know what they're working with.
Yeah.
A lot of the other guys are not as fortunate as maybe what we are at the University of Victoria, where we can do the screening, where we can individualize basically everything for each and every athlete. So communication for other guys it's gonna be key. How are you feeling? What's the situation? Those sort of things. So in terms of that is you're going to have to coach what's in front of you. Communication is going to be key, and also you're going to have to individualize your schedule so that it suits each and every athlete that you're working with.
Okay. So yeah, I think we're going to leave it at there today, gentlemen. So once again, Coach Paul, thank you very much for your time and also on your insight. All the best with the preparation, although the Olympic Games has
no
been
problem
on to next year. Dr. Byron Haupt and Dr. Ntokozo Bena, you guys are in our front lines. You guys are working on a daily basis still. You guys don't have the luxuries of staying at home as me and Coach Gorries have. But all the best for you guys, and thank you very much for you guys.
No, it's no longer a luxury.
Thank you very much for you guys.
I would have lost my mind if I had to stay at home all the time for the last 5 weeks. So,
yeah.
So guys, thank you very much, and we chat soon again.
Cool.
Cheers.
Thanks, Alroy. Cheers, guys.